But it looks like they're working out those details, so hopefully.
和助理仔细讨论替新冠疫情开药方，他是台湾精准医疗计划的主持人，正是现任中研院生医所所长郭沛恩。中研院早在2017年就展开精准医疗计划，透过基因检测可以协助医师开出最适合患者的药物。
This is to make all the reactions, and after the reactions on this unit, and then it goes to the red machine. So the red machine is where you do a lot of the what we call scanning.
原本在美国加州大学旧金山分校任教的郭沛恩，2017年被中研院院长廖俊智挖角来台。拥有芝加哥大学有机化学和医学双博士学位的他，专攻人类遗传学、基因组学、DNA 序列变异和生物技术等，是发展精准医疗的先驱。我们采访团队跟着他，首度踏进中研院生医所的基因型分析实验室。这是国内相当重要的基因遗传实验室，就是由郭沛恩带领团队每天全副武装、全神贯注在做研究。
If there are very few cases in Taiwan, then having a good border control is very good. But now it's a different story because now that there are many, many more cases in Taiwan than other countries. So when I come in from the US or other places, I'm not bringing anything new to Taiwan. So if I were in charge, the border controls will be completely relaxed because all the people that we spend time working at the airport can be redeployed to help with the pandemic in Taiwan itself. You know, all the PCR resources, all the people who do testing, and all the rules can be suspended.
So when would you suggest opening the border?
Today. So quarantine only works if there's nothing inside and you want to keep something from coming in. But at this point, there's no quarantine that will work because it's already in here. Something that we should be doing, you know, more educated, reasonable, easy to follow rules, not rule because of fines and prison terms, but rules that you know that we can help prevent the spread of disease and also prevent serious illness. What we have to change is really to make sure that instead of worrying about how many cases, we should worry about how to make sure that the people who are vulnerable can be protected and be treated and keep them out of the hospital. Because if we look at the numbers, it's almost pretty sure that for 10 people go into the hospital, one person will die. So all over the world, it's about the same number. And so I think that's the reason why we want to keep as many people out of the hospital as possible. So I think this is going to be the most important point, is our policies have to change from focusing on blocking infection to blocking hospitalization and death.
When and how do you think oral antiviral drugs should be given to positive cases?
Is that the medicine doesn't get to the patient fast enough. So I think that there are two reasons. One is that right now the procedure for someone to get to the medicine takes too long. You have to report, you have to get certified, and then you have to check your medication list and things like that. So sometimes it takes several days to get to that. And I know that the CC is trying really hard to make it shorter. And I think that's really important that they do that. So one thing that we can actually do, and it's probably Taiwan is the only country that can do this, is because we have such good national health insurance data that my team has tried to do something like this in the Taiwan Precision Medicine Initiative, is to look at our patients' clinical data, and we can already divide up the people ahead of time, whether they should take the Pfizer drug or the Merck drug. So if we have all this already pre-calculated, so to speak, then when someone needs the medicine, they can get it right away without waiting for the doctors to review the chart and do all that stuff. So I think this is the concept of test positive and treat, which is something I think the CECC wants to do. So there are some operational things that we can help. And I think that this is not something that is so difficult to do, but if we do it, it will really make a difference, because the earlier you treat the patient, the more effective it is. Even though it says 5 days, if it's 2 days, it's even better. I walk along the street and I walk by a restaurant. People in the restaurant don't wear a mask and they're eating, laughing, singing. But then I'm walking outside, I have to wear a mask. So that doesn't make sense, right? Because if I can sit next to you without a mask, laughing, drinking, eating, when I'm outdoors, when the infection chance is so low, that I'm required to wear a mask. So that is a contradiction. So easy policy change would be just say, okay, just wear a mask when you feel like you need to protect yourself or others. And we teach people the correct principles and let people govern themselves.
So according to the example, so when do you expect that the need for face masks to be lifted?
Masks should not come off if we want to protect someone, either ourselves or someone else. So I would say, don't make it a law, don't make it a criminal act when you don't wear a mask, but really educate people. If we look at the curve, most likely we still have about 5 to 8 weeks before the wave is done. And so even if we give someone vaccination today, 2 weeks from now, they will be protected. Then that means that the next 4 to 6 weeks, we can really significantly lower the rate of infection. So I think that, the CECC has been really begging everyone to get vaccinated. And I think that the media should really kind of help spread the word, especially for the older people. I know that the CECC is already vaccinating the nursing home people, but there are so many, uncles and aunts and grandpa, grandmas at home that we really need to get them vaccinated. In the experience of other countries, after 15% of the population get infected, then the wave is done. So whether that's herd immunity or not, I don't know, but most likely. So that means that right now, we still have another, quite a bit. We're about less than 10%.
How would you evaluate the control measures of the COVID-19 pandemic in Taiwan?
The CECC has done a really, really good job. And it's actually responding to this wave very, very quickly. I mean, much quicker than other countries. So I'm very impressed. And I think that they're learning a lot from other countries in how to handle this pandemic. We should preserve those resources and do it. So I would only test if someone has symptoms. Okay, so even if I am exposed to someone who has an active case, I don't test until I'm symptomatic. So, and then if the companies don't require that people have to test every week and things like that, all those resources can be redirected to take care of the most vulnerable group.
政府要朝与病毒共存方向前进，政策该如何滚动式检讨与做好配套措施？专家也一起想方设法打团体战，追上病毒。金新闻陈彩玲、林乃俊、陈志宇、徐孝安采访报道。